Assalamu alaikum and hello all the listeners. I'm going to talk about Lefort 1 fractures today in this session. Um, as we know that these are again very important fractures of the face and that comes into the facial fractures. And you know that there are three types of Lefort fractures, but I have chosen Lefort 1 to talk about, and I'll be telling you in details what type of fracture it is, what does it involve, what are its lines, and how do we treat this case. So first of all, we need to diagnose the Lefort 1 fracture, means what are the fracture lines of this Lefort 1 fracture. Before going to this, I will tell you a little about that. This is called a horizontal maxillary fracture or a floating fracture. Why do we call it a floating fracture? Why do we call it horizontal? It means there are other fractures that have the fracture line that originates into the vertical direction. So this is actually the fracture whose fracture line is actually horizontal in nature. So the fracture appears in a way like it separates the maxilla or it separates the upper arch from the rest of the face. So that's why we call it a floating fracture. And this causes entire mobility of entire palate or entire maxilla. If you can see here in the frontal view, you can well appreciate this fracture line in red. Okay, and if we see the palatal view of the same fracture, you find the fracture line this way. So this fracture line separates the maxilla from the rest of the facial skeleton. So that's why we call it a floating palatal fracture, and that is usually present below the floor of the nose. So the fracture line is in the way that it is present below the nasal floor, but the appearance of the fracture is it leads to detachment of the maxilla from the rest of the facial skeleton. So what are the fracture lines in proper words? We see it crosses the apices of the maxillary teeth. If you see here, these are the maxillary teeth and these are the apices of the teeth, and it crosses the apices of the maxillary teeth and through the lower part of the nasal septum. If you see here in this picture, the fracture line is in a way like it is crossing the apices of the maxillary teeth, then it is going towards the nose, but crossing the bottom of the nose or floor of the nose, okay, and passing through the nasal floor, crossing through the piriform aperture. This is the part of the nose, okay, crossing through the piriform aperture, and from one side to the other side it is going, and again involving the floor of the maxillary sinus or the lateral wall of the maxillary sinus. And it again crosses upwards towards the zygomatic bone and zygomatic buttress. If you see, it crosses through the zygomatic buttress, and then eventually it ends up with pterygomaxillary junction or pterygomaxillary plates. Okay, so this is basically a fracture line of this Lefort 1 fracture. And since the line is running all the way through in a horizontal pattern, so that's why we're calling it horizontal fracture. So what happens in this fracture? First of all, we need to go for investigation if patient has come to us. In investigation, we need to take a detailed history. Definitely, patient will give history of trauma. And in trauma, after trauma history, we need to see the patient's, current situation, that what is the proper status of the patient at the moment when the patient has come to you. So first of all, if the patient normally after the trauma, of the injury, they will be unconscious, or if conscious, even then you need to go for thorough evaluation. So thorough evaluation based upon the ABCDE protocol of trauma. In A, we need to look for airway, that patient is having sufficient airway or not. If not, then we place the suction tube, we get the secretions out of the oral cavity in order to make the patient able to have proper breathe. Okay. Then B, we have to again check for breathing, that we need to see if the patient's chest is properly working. We need to have, through STET, we need to see this that the chest is auscultating, these auscultate sounds are present or not. Then any sort of chest injury present to the patient, as in this picture. And then we need to see if patient is having any chest injury or not, and we need to assure this thing as well. Afterwards, we need to see circulation. Circulation means we need to see patient's blood pressure, and we need to see that if the patient has, bleed externally too much, then we need to apply pressure packs in order to stop the bleeding. If needed, definitely needed, we have to maintain the IV line, and we need to establish a good blood, we give the fluids to the patient as required. If the patient has bleed too much, then maybe needed that we'll be going for blood transfusion. Then any disabilities of the patient, then we have to check for neurological status of the patient, the size of the pupil, the reaction of the pupil, the neurological status of the patient, any sort of seizures or not, we need to confirm with D. So D stands for disability, that are basically the neurological disabilities we talk about. Then we look for the exposure, assessment of associated injuries. Other than this facial injury, we have to have a proper exposure of the patient. We remove the clothing if a male. But for female, we have to be definitely, we have a different way to assess her. Then you need to see proper chest of the patient, abdomen of the patient, the limb, the spines, the extremities, and everything, to be assured of that the patient has got any other injuries other than this facial fracture. So you need to rule out these all things via following this protocol that is called as ABCDE trauma protocol of the fracture or of the injury. So afterwards, we have to go for extraoral examination. There are some particular features of Lefort 1 fracture. In Lefort 1 fracture, what happens that the patient usually, as we said, this is the fracture that involves the floor of the mouth and lower part of the face, somehow the middle part to lower part of the face. So mostly patient with such fracture has facial swelling, definitely due to injury, and maybe the patient will have asymmetry of the face. So you have to first of all look for the patient's asymmetry and lower mid face in order to see that what type of fracture, to be assured that you have a Lefort 1 fracture or not. Then usually in such cases, patient has epistaxis, that is bilateral epistaxis, means bleeding from the nose, because patient has got the injury into the nasal floor and pyriform aperture. So that's why he will have bleeding from the nose, and he will have lacerations on the face, of course, because of the injury. Then you need to assess any tenderness or crepitus over the pyriform aperture and the zygomatic buttress in order to see what are the margins of the fracture. Then we have to again see infraorbital nerve numbness, because the fracture line is crossing your zygomatic bone. So we need to be sure that if the patient has any problem with infraorbital nerve or not, or when you are sensing it, patient feels the sensation into that particular region or not. Then definitely after clinical evaluation, you need to have the radiographic evaluation. Basically, in such cases, we do not go for baselines like OPGs and all. We normally go for other scans. These are usually called as CT scans. Okay, to have a good overview of the fracture line and any associated traumatic injuries. So these are actually this is actually the evaluation we perform extraorally. Then comes intraoral evaluation. As we said, that is a free floating fracture. When we place our finger inside the mouth and we try to move this maxilla, this maxilla will be mobile. It will be moving upward, downward, and it will be moving anterior, posteriorly. So again, you will find the lacerations in the patient's mouth. You can find the laceration over the palate. Definitely there is a fracture, so patient may or may not have loss of teeth and fractured teeth, and all these things you need to evaluate. If such lacerations are there into the sulcus or over the palate, it again gives you a clue that the fracture line is passing through this particular region. And again, it gives you a clue that the patient has got Lefort 1 fracture. So, how do we see the maxillary mobility? We make the patient sit, rest head properly, and after stabilizing the head, a surgeon keeps the finger, stabilize the head with one hand, and he tries to move the maxilla of the patient. Once he tries to move the maxilla, and if there is a fracture, Lefort 1 fracture, when he grasps the teeth, he will move the teeth anterior, posteriorly, and upward and downward. Then all the region will be floating. And this floating confirms that patient is having Lefort 1 fracture. And these are the direction the surgeon will be moving the maxilla, or he will be moving the palate to confirm this. So, what investigation we do? Definitely after detailed history, after clinical evaluation, after intraoral, extraoral examination, then we go for imaging. Like as I told you, CT scan. CT scan is actually gives you a proper visual or proper idea of the fracture line, and if you can see that these are the some two different views of the CT scan, and it is showing you that the fracture line, this yellow, if you see with this yellow, it is indicating that the fracture line is extending from here. You can see that the maxillary sinus is hazy. It means that this is filled of blood, and you can see that a patient's nasal cavity has also got trauma. So you can again well appreciate the presence or involvement of the posterior palate in this X-ray, as well as we said that the fracture line of this type of fracture, Lefort 1 fracture, extends posteriorly till the pterygomaxillary fissure or till the pterygoid plates. So these are the X-rays when you get, and they will give you after the clinical examination, they give you more clue about the X-ray. How do we manage this case? First of all, as we said, emergency management, we need to secure ABC of the patient. We need to have a proper and thorough, evaluation, and we maintain the airway of the patient. We protect the cervical region of the patient or spine of the patient. We need to clear all the blood, all the secretion, all the fragments from the patient's mouth in order to allow proper, airway to the patient. In case of nasal hemorrhage, definitely in Lefort 1, there is a nasal hemorrhage. So we need to control the bleeding, and we need to treat other sort of injuries which are associated with Lefort 1. We provide patient with analgesics, and we aspirate, we go for aspiration of all the content present into the oral cavity as well as into the nasal cavity. We treat the wounds topically, and definitely as patient has got injury, we provide the patient with tetanus injection. Okay, and in cases of ophthalmic injuries, neurological injuries, we need to have opinion or assessment of the specialist for those patients. After evaluation, emergency, this is the first emergency management. Now come for the definitive management. Now for the definitive management, you need to see whether the fracture is undisplaced or displaced. If fracture is undisplaced, though fracture line is there, but your maxilla is not that mobile, not free floating, then undisplaced fracture, actually we just need to, a little of the occlusion is disturbed, then we just need to manage occlusion if needed, and we ask the patient that have a soft diet, take oral hygiene measures. We prescribe patients with analgesics and close evaluation, at different intervals. We keep the patient on follow-up. But it does not require any sort of big procedures. It is usually managed conservatively because fracture line has not displaced. Okay, but when the fracture line is displaced and when the maxilla is mobile, then you need to have proper treatment. First of all, you need to go for surgical approach in order to expose the fracture region. Then we place the maxilla, this mobile maxilla via disimpaction, or this mobile maxilla is, we try to place the mobile maxilla properly into the its proper position by keeping the occlusion of the patient in mind. Once we place the maxilla properly, then we obtain the proper occlusion of the patient, and we seal the occlusion by means of intermaxillary fixation. Once this is fixed, then we go for anatomic reduction. Then we need to see whether after reduction we need to be assured of this thing that the patient's profile is not disturbed. Then, if needed, we go for rigid fixation via platings and via, by seeking help from the stable part of the bone, and we go for rigid fixation at the nasomaxillary buttress bilaterally, and then another way of rigid fixation, we can go for horizontal fixation, whatever way it is needed. So then after fixation, we check and we reassure that the patient fixation is done in a way that his occlusion is not disturbed. Okay, and then finally, when stable occlusion has been achieved, when the mobile portion is fixed, then we keep the patient on a follow-up, and then after follow-up, we reassure the patient that patient will not have is taking proper soft diet, patient is taking proper medications, patient is maintaining hygiene, and patient is giving you proper follow, because compliance of the patient is very important. So what complications occur if the fracture is not properly treated, or this fracture line is left like this? So early complication, definitely when patient has got injury, patient's mouth is full of blood because of the hemorrhage, because of the debris, because of the aspirants of the oral cavity, because of fragments of the fractured bone. So it can lead to airway obstruction. Definitely, it involves the maxillary lateral wall of the maxilla. So there are high likely chances, if not treated, the bacteria can penetrate into the maxillary sinus and cause sinus problems. Definitely, again, in this case, patient gets the hit to the teeth. So there can be dental and pulpal injuries, there can be soft tissue injuries, and involvement of the fracture line is such that it involves the mid of the face. So there are chances that the patient may have sensory disturbance. Okay, so this all needs to be treated well in time. Late complications after the treatment. Actually, these are the complications before the treatment, when the treatment is not done or patient did not reach to you in time. There are some complications which occur afterwards, like after you have done treatment. Maybe we did not do proper disimpaction. We did not look for proper, alignment of the arch. Patient will end up with malocclusion. Patient may end up with anterior open bite. Patient may end up with asymmetry of the face, malunion, delayed union of the maxilla, and patient may have chronic maxillary sinusitis. If not properly treated, we did not get proper evaluation from the ophthalmologist or neurologist, then patient may develop infraorbital sensory disturbance. Patient, if we did not treat patient well, we did not ask the patient to follow the instructions well, or maybe we asked the patient to follow the instructions, post-op instructions, oral hygiene maintenance, and patient did not follow them, then patient may get periodontal problems, devitalized teeth, exposure of those hardware which we have given to the patients, and TMJ related problems. So these complications may arise if not treated, and the complications may arise if the patient is not properly treated. Thank you so very much. You can contact me on a given number via WhatsApp if you have any query, and you can email me on a given email address for any query. Thank you so very much. Hope to see you with a new video, inshallah ta'ala, with a new topic.